We're living longer these days, and that's good news. As we start to age, we need a little more care to keep us going strong. When we get up to retirement age and beyond, chances are we'll require some help. But who will you turn to when you need home health care? You could ask your children. Sure, they'll do what they can, but no one wants to be a burden on their kids. And in-home health care adds up quickly. It can cost thousands of dollars a month. Add to that the expense of prescription drugs you'll need, and you're in a quandary. Will you spend all your retirement savings? Or will you ask for your family's help? There's a better choice. Home health care insurance, offered through your insurance professional. It's an easy and quick solution to the problem. I know what you're saying. I'm already covered by my health insurance. Lots of people think this is true, but in most cases, it isn't. Home health care is not covered by other kinds of insurance, including your HMO, health plan, or even long-term disability insurance. Only home health care insurance you typically purchase on your own covers day-to-day personal care assistance. That's when you need help with everyday activities like bathing and dressing. Our policy covers that. Maybe you're thinking, okay, but there's always Medicare. Medicare does not generally cover home health care or long-term care. Medicare pays for skilled care in a nursing home only for short periods. It will pay for only the first 20 days, while you're recovering after a hospital stay for a related condition. After that, you pay a copay for days 20 to 100. Once you're ready to go home, you may need personal or custodial care, and Medicare will not pay these costs. Medicare will only pay for care at home under very limited circumstances, and it pays for long-term care only for people with very low assets and limited income. Now, you're thinking, that makes sense, but I've got plenty of time. I'm not elderly. The reality is, a need for home health care can arise at any time. It's true the majority of people who require long-term care are elderly, but younger people can require at any time due to sudden, unexpected illnesses, diseases, injuries, or accidents. Many people believe that if they're healthy, so they probably won't need care. Being healthy is certainly a great advantage. Thing is, according to a recent report, a 65-year-old today has a 70% chance of needing home health care services at some point during his or her lifetime. And when you consider that people are living longer on average, the chance of needing home health care is likely to increase in the future. Then there's always the family. They'll take care of me. While families do and will continue to provide care, it's not wise to gamble on their ability to be available and able to care for you when the time comes. For instance, the type of care you might need could require professional help or stay in a nursing home or assisted living facility. Having a home health care policy will allow you to receive care in your own home. And because a wife often outlives her husband, she is less likely to have someone nearby who can provide care for her. In addition, caring for a family member can be a huge financial and emotional burden on your loved ones. Of course, they'll do it. That's what families do. But do you really want to ask them? And what about the costs that come with long-term care? Can they afford it? It's important to decide how you want to be cared for and ensure that you are protecting your family. The fact that family members are willing to help has no bearing on the cost of coverage. It just makes good sense to have plans in place to address the high costs associated with home health care. We offer a great policy that gives you choices for your care and includes prescription drug benefits. It's a simple process to enroll and takes very little time. Contact one of our trusted agents for more information. Home healthcare insurance from Senior Lifestyle Solutions and Retirement Insurance Solutions. We're here to help you when you need us.